A very good evening to everyone. My name is Dr. Shashanka Dhanuka. I'm a consultant urologist and urosurgeon practicing in Kolkata, attached with Medica Superspecialty Hospital in Kolkata. I was previously working as a consultant urologist at the Royal Blackburn Hospital in the NHS in UK. Today, the topic of discussion is on BPH and metabolic syndrome. So, these are two things that are closely interconnected, and with every passing day, we are able to find more and more link between these two. First of all, I would like to tell you about what each of these basically means. BPH stands for benign prostatic hyperplasia. So, prostate is an organ, a gland located below the bladder in men. And when this gland starts increasing in size with advancing age, if it's benign increase in size, it's termed as BPH. The symptoms due to prostatic enlargement, various kinds of urinary symptoms, are collectively known as lower urinary tract symptoms or LUTS. In short, we call it LUTS. So LUTS and BPH are two terms that I'll be using very frequently during the talk. The other thing is metabolic syndrome. So it is very important for everyone to understand what the metabolic syndrome is. Basically, it's a cluster of metabolic abnormalities which is related to two central concepts. Number one, central adiposity or central fat, central obesity. And secondly, insulin resistance. These two concepts underlie the very pathogenesis of metabolic syndrome, and it is very closely related to cardiovascular health in an individual, and it is also very closely related to LUTS and BPH, as we shall understand. So, this condition, metabolic syndrome, was described in the 1920s. It's nearly 100 years that we've known about this syndrome, but the pathogenesis is still not very clear. A lot of research has been done, a lot of definitions have been tried by different organizations, including the WHO, including the American Heart Association. And there are a few common points which are present in most of the definitions. And that is what I would like to share with everyone here in the audience today. So, the important things that were highlighted by the WHO group was on the insulin resistance, but there was no easy way of measuring insulin resistance. So the European group started measuring the fasting insulin levels in an individual and combined it with the waist circumference of the individual. After this, the Americans made a new definition where they included 5 components. Most of these are relevant, and this definition is mostly followed by a lot of organizations across the globe. So I'll tell you the 5 components of the metabolic syndrome as per the American definition are: number one, central obesity; number two, hypertriglyceridemia, basically when you do a lipid profile and your triglycerides are high; number three, reduced HDL cholesterol. So everybody knows there are bad cholesterols and there are good cholesterols. The HDL cholesterol is the good cholesterol. So if you're having a low level of HDL cholesterol, it's one of the markers of metabolic syndrome. Number four is a raised blood pressure or hypertension. And number five is raised fasting blood glucose, that is diabetes. So we are looking at a syndrome which includes central obesity, high blood pressure or hypertension, diabetes mellitus, and a deranged lipid profile. This is the basic idea of metabolic syndrome for the common man. Any three of these five being present in a person means the person is suffering from metabolic syndrome. The interesting thing is, a lot of people, even in the absence of being obese can be suffering from metabolic syndrome. A diabetic with hypertension and with, say, a low HDL cholesterol is still suffering from metabolic syndrome, even though they may not be overweight, they may not be obese. And there's a difference between various ethnic groups. So the Europeans have different cutoffs, the Americans have different cutoffs, and for the Asian population, it's different as well, because our body habitus is different. So Asians have a higher level of body fat and more abdominal adipose tissue. That's the reason why the waist circumference cutoff is different for Europeans, different for the Americans, and different for us Asians. So for Asians, the cutoff is 90 centimeters. This is the waist circumference. 90 centimeter translates to 36 inches. So the next time, all you men, when you're going to get a trouser and you're getting your waist measured, if you're measuring more than 36 inches, you need to be careful. Okay, epidemiologically. So the incidence of metabolic syndrome has been increasing all across the globe very rapidly. And the incidence of LUTS and BPH is increasing at a very fast pace as well. It is interesting to see that the risk of having metabolic syndrome in men with clinical BPH is increased by 37%. So if a person is having clinical BPH, the risk of this person having metabolic syndrome is increased by 37%. It is very important to understand that it's a reciprocal relationship. It is not that one causes the other. So BPH, LUTS, and metabolic syndrome have a reciprocal cause and effect association with each other. And there are strong positive associations with various laboratory parameters like the glycosylated hemoglobin, the HbA1c, the history of hypertension, a low HDL, high LDL, the presence of LUTS, a history of LUTS in the patient. All of these have strong positive associations with metabolic syndrome. So the prevalence of LUTS, the lower urinary tract symptoms, has been increasing rapidly, and more so in Asia. I'll share a statistic with you. As recently as 2018, 2019, the prevalence of LUTS is about 45% in men in Asia. This is nearly half of the population. So it's a very big number. All right. So metabolic syndrome, on the other side, has also shown direct correlation with prostate volume, with prostate size, and with the annual prostate growth rate. So those who are suffering from metabolic syndrome, their prostates grow faster and they grow to larger sizes. And usually they translate into more symptoms. So they are definitely interlinked with each other. There are various biological explanations to the metabolic syndrome, and those which have been most accepted and understood are those that I'll talk about briefly so that you can understand the importance of the lifestyle modifications that you can do in your lives and prevent metabolic syndrome and prevent BPH, LUTS, and complications because of those. So the number one on the list is insulin resistance. Now, this is a very, very complex subject, but it is very important for everyone, every common person to understand that insulin resistance is not just in diabetics. Insulin resistance is very much related to the diet that you consume. It is very much related to obesity and visceral fat in the body. And lifestyle changes can bring down insulin resistance, and it can bring down various complications that arise due to insulin resistance. There's another chemical in the body known as insulin-like growth factor, or IGF-1. This is also a culprit because it causes prostate epithelial growth. And the more there is inflammation in the body, the more there is IGF-1, the more there is prostatic growth. So insulin resistance is the number one biological explanation for the metabolic syndrome and its effects on the prostate health. The second thing is hyperglycemia. So diabetes, a high blood sugar, is directly related to increase in prostate size. And in those with BPH, if the person is also diabetic, if a BPH patient is also diabetic, the risk of suffering from moderate to severe LUTS is doubled in these people. So it is very important to understand that diabetes coexists with BPH, and the complications that arise thereof are more in diabetics who are suffering from BPH. The third thing is increased visceral adiposity. So visceral adiposity means central fat, the fat that sits in the central part of your abdomen. It may be the waist, it may be the inner fat. So visceral fat actually means the fat inside your tummy. This fat promotes insulin resistance, and this fat directly also contributes to various complications, cardiovascular complications, as well as prostatic complications. There is an enzyme called aromatase which converts testosterone or androgens into estrogen. So obesity or visceral fat increases the aromatase activity and thus increases the estradiol concentration in men. And this causes various secretion of various bioactive substances like adipocytokines. They induce more insulin resistance. They are pro-inflammatory, so they increase inflammation in the prostate, and they increase the size of the prostate. They increase the symptoms due to prostate. So these two are very central to the pathogenesis of BPH. The next one is dyslipidemia, which is a very important component of metabolic syndrome. So a deranged lipid profile, as I said, low HDLs and high LDLs. This is directly related to symptomatic BPH. It has been seen that in symptomatic patients of BPH, their LDL levels are higher and their HDL levels are lower. And there's a direct correlation between the two. So all of these things together contribute to what we call a chronic low-grade pro-inflammatory state. You must have heard about markers like CRP during the current COVID pandemic. High CRP levels also translate to high cytokine levels in the body, TNF alpha, IL-6, IL-1. All of these are pro-inflammatory cytokines. All of these contribute to cardiovascular disease as well as prostatic disease, and they are very much connected to the level of blood glucose, the level of obesity in a person, and the level of activity that a person undergoes. All right, so there are a lot of implications and there's a lot of importance of understanding the connection between these two, because LUTS has a direct relationship with adverse cardiac events in the male population. So those who are suffering from LUTS and BPH, all the men, more so above the age of 50 years, they are at a higher risk of cardiac events. And the reverse is true as well. So those who are suffering from more cardiovascular problems and have deranged lipid profiles and are diabetic or are hypertensive, they're more prone to develop BPH and LUTS and more moderate to severe symptoms due to the prostate problems. So we come to the most important take-home message from today's talk, that there's a very important role of diet and lifestyle modification and weight reduction in your prostate health as well. I'll just emphasize that a lot is talked about cardiovascular health, and people understand that once they have a block in one of the coronary arteries, they go to a cardiologist and they either are prescribed some medicines which will prevent further blocks from happening. They undergo angiographies and angioplasties if there is a significant block. And if it's a complex disease involving multiple arteries, they undergo bypass surgeries in the form of a CABG. So in addition to the treatment of these problems, there's an increasing awareness about preventing these problems. And people understand the importance of weight reduction, understand the importance of an active lifestyle, importance of maintaining their blood sugar levels to prevent cardiovascular disease or cardiovascular events. I would like to emphasize that the same is true for your prostate health as well. BPH and LUTS are very much similarly connected to all these factors. And for all men, it is equally important to understand that all of these lifestyle modifications are going to help with regards to your prostate health as well. What's good for your heart is good for your prostate. It's a very common saying, and people need to remember this in their minds. All right, so there's a favorable relationship, and a lot of studies have proven this, that there's a favorable relationship between increased physical activity and weight loss with a decreased risk of progression of BPH and LUTS. This has been proven by various studies. Coming to diet and micronutrients. So high levels of fruits and vegetables. Now, this is another thing that has gained a lot of importance, and I would imagine that this is more so in the current ongoing pandemic, when people have started focusing more on their health and more on their diet. So an increasing intake of fruits and vegetables definitely helps with the obesity situation. It helps with your blood glucose control. It helps with your blood pressure control. It also directly helps with decreasing the progression of BPH and decreasing the lower urinary tract symptoms that arise due to that. So increase the intake of fruits and vegetables and decrease all the animal protein intake, more so the red meats, because they have an adverse relationship with prostate health. All right, statins have been emphasized by a lot of medical groups, and statins are the medications like rosuvastatin or atorvastatin, which your cardiologist or your physician prescribes you when there is some derangement in your lipid profile. So the statins help to bring the HDL levels back up and bring down your LDL levels and triglyceride levels. So statins have also independently shown benefit in prostate health as well. They have shown to stop the progression of BPH and to decrease the symptoms that arise due to prostatic enlargement. So continue taking your statins if they have been prescribed by your physician or your cardiologist. All right. Biguanides like metformin, the common drug used for diabetes. Metformin has various beneficial effects. In addition to controlling your blood glucose, it also improves your insulin sensitivity. It also works as an anti-inflammatory agent. So metformin has also shown direct correlation with halting the progression of BPH and reducing the symptoms or the progression of symptoms that occur due to BPH. All right. So I would like to conclude. These were the technical things that have been shown in various studies. I would like to emphasize that during the current pandemic, or when people are coming out of the pandemic and resuming their regular life, I would like to highlight that there are three things that you should always remember with regards to your heart health as well as your prostate health. Weight loss, blood sugar control, and active lifestyle. So weight loss, which is very important. Obesity is the #1 killer on the planet right now. The number of complications that arise due to obesity outnumber any other condition in the body, and this is a preventable risk factor. So obesity does not run in families. Obesity runs in families that do not run. So try and understand this. Just don't blame your genes or your family history for your obesity. It's not that obesity just runs in families. It runs in families that do not run. So basically, you need to have an active lifestyle. You need to move more, have an active lifestyle, go out for a walk, work out, whatever suits you. But be active to stay healthy and keep an eye on your body weight. Try to stay below the obesity BMI and control your central abdominal fat. So that is very important. The adipose tissue in the central part of your tummy, that is the biggest culprit that contributes to most of the complications that happen in the prostate or your heart, or your liver, or your kidneys, all the organs in the body. So take care of the central obesity. Diet is something that should be emphasized much more in today's world. People should cut down their consumption of refined foods, packaged foods, all the soft drinks. They are freakingly rich in sugar content, and that is very, very harmful for all the organs in your body. So cut down on all the carbonated beverages that are just dumping loads of sugar into your body. Eat lots of fruits and vegetables. Control your animal protein intake, and keep an eye on your blood sugar levels. Keep an eye on your blood pressure levels. Lead a healthy lifestyle. And if you do develop low urinary tract symptoms, if you do develop BPH, consult a urologist. There are a number of treatments available, starting from lifestyle modification, medical treatments, all the way up to surgery. And the results are very good. But remember, prevention is always better than cure. So try and prevent. If you're more than 50 years of age and you've already started developing BPH, your aim should be to control the growth of your prostate gland, to control the symptoms arising due to that. If you're 30, 40 years old, it's a good time that you take care of your diet and lifestyle to prevent the very development of BPH and LUTS. So all that I've mentioned in this talk is relevant to all the people across all age groups, all men, because eventually all men are prone to develop BPH and low urinary tract symptoms arising due to that. Coincidentally, it happens to be International Men's Day today. So all the more reason that men should wake up and take care of their prostate health. And all the women who joined us in this talk today, metabolic syndrome is very much a part of everybody's life. And all the women also need to have the same lifestyle modifications and control on their body weight and their diet intake, so that they do not suffer from the complications of metabolic syndrome as well. So that's about it, I think. And I'll take a few questions. We have some time on our hands, so I'll take a few questions. You can type it in the chat box. I think some people want to join on the video as well. So I'll try to answer a few. There's a question, by the way, in the chat box about, in current COVID times, is surgery of the prostate safe or not? Yes, it is safe. So we perform surgery in patients who actually need it, and the risks due to surgery, the benefits due to surgery outweigh the risks. So it is safe, and we've started performing, definitely after performing a COVID test and ensuring that the person is negative, and trying to maintain as much COVID distancing and keeping COVID patients separate from the non-COVID patients. So all of that, maintaining all of those protocols, it is safe to undergo prostate surgery if it is really indicated in the present time. Okay. How smoking increases the risk of BPH? Right. So smoking also increases the risk of BPH. Smoking increases pro-inflammatory cytokines in the body. So like it affects all the other organs in the body, it is also shown to increase BPH progression in men. There is a correlation with smoking as well. And for diabetic BPH patient, which of these drugs is more suitable, dutasteride or finasteride? All right, this is a very, very individualized choice. I would not like to make a generalized statement about finasteride or dutasteride. It has to be individualized according to the patient. Thank you very much for listening. And just remember, control your weight, control your blood sugar levels, control your diet. Fiber intake is very important. Cut down on your sugars, cut down on the animal proteins, cut down on saturated fats. These are things that are good for your heart. These are things that are good for your prostate health as well. So thank you very much for listening, and take care of your health, lead an active lifestyle, and happy International Men's Day to all the men. Thank you.